Dr. Pragyanika, infertility consultant and gynecologist with Bhagirathi, Neotia. Many patients come to us asking the question, Ki doctor, how can we improve our chances of conceiving naturally? To quote one of my patients, they had said that as long as they were not trying to have a baby, it was okay. But once they started trying to have a baby and they were not able to, it was very frustrating and a cause of great stress to them. And this scenario is seen in most of the patients. Generally, a couple has 1 in a 5 chance, that is around 20 to 25% chance of conceiving in one cycle. So around 84% of couples will conceive in 1 year, and that is the threshold of infertility definition, that if you have been trying to conceive for 1 year and you are not able to, then you should seek treatment. But many couples, around 10 to 15% of couples will go ahead and conceive in the 2nd year. So when you are trying to conceive, knowing how you can increase your fertility chances can be of great help. Fertility of a couple can be affected by various things, primarily by age, by your lifestyle and by your biology. You have to understand that if any changes you want to make will take your body will need to adapt for about 3 to 4 months. So if you are having any contraceptives, you should stop that. If you should start on certain vitamin supplements such as folic acid. Eating healthy is very important. You should avoid junk foods, fatty foods, oily foods. Increase your fluid intake, lots of fruits and vegetables. And also avoid too much of sugary and processed foods. Increase the fiber content of your food and avoid foods generally which are packaged or processed. Next is, are you having any addiction? Generally, if you are, then this is the time that you should stop. It has been seen that smoking and alcohol intake can have a detrimental effect on fertility. Next question you should ask is whether your periods are regular. Generally, if your periods are regular, that means you are ovulating or you're ovulating regularly. If your periods are irregular, and if it is not coming for about 3 months or so, then it is an indication that you should contact your doctor. Thirdly is, you should ask is how your weight is. Are you overweight? You should check your body mass index. Now, what is body mass index? That is, it is determined by your height and your weight. So, if your body mass index is ideally around 18 to 24. So, if it is above 24, that is your overweight. And if it is above 30, that means your weight is an issue and you should try to reduce it. So, how you can reduce your weight? By diet and as well as exercise. Exercise will not only help you reducing your weight, it will also help you to increase your happy hormones, promote a sense of well-being, decrease your stress and anxiety, and help you to conceive. So, besides this, another thing that you should know when you're trying to conceive naturally is when is your fertile period or when are you ovulating. Generally, we do not advise ovulation monitoring initially. Now, how do you calculate your fertile period? Suppose you have a 28-day cycle, then your fertile period is around 14th day of your periods. And so your period, if it is around 35-day cycle, then it would be around day 20. So generally your fertile period is around day 8 to day 18 or 20 of a cycle. This is because the egg is usually stays alive for around 24 hours while the sperm stays alive for about 3 to 5 days. So we should, the frequency of intercourse should be about 2 to 3 times a week during your fertile period. And as we know that it takes 2 to tango, the male partner should also take care of his health. If he is overweight, then he should try to reduce his weight. If any addiction such as smoking and alcohol, it should be stopped completely because it has been seen that these have detrimental effect on the sperm quality. So in short, you should plan ahead, review your medications, start your folic acid supplements. Don't lose heart if you don't conceive in the first cycle. And generally, if you put too much of pressure, if you take too much stress, then it will take longer for you to conceive. So you have to stay positive, have positive lifestyle changes and try. And if you are not able to conceive within a year, you should consult your doctor.